Recently, you have been frequently asking me this, "Teacher, are heart diseases occurring at a much younger age?" Actually, there is some truth to this. But with our early diagnosis, this possibility has increased even more. So, can I recognize heart diseases early? Can I identify this without feeling the need for any examination, even before coming for any checkup? In this video, I will talk about the 10 hidden symptoms of heart diseases. If you are ready, let's get started. I presented heart diseases as a general category because the only issue here is not a heart attack, and the only disease of the heart is not a heart attack. Heart failure and rhythm problems are also included. The heart has many diseases. So, if any of the 10 items I will list are present, recommend that you undergo an examination related to the heart. Our first item is a feeling of discomfort in the chest. Only complaint of the heart is not chest pain. The only complaint of the heart is not palpitations. If you frequently feel discomfort in your chest area, especially during exertion, that wakes you from sleep, and a feeling of discomfort in the center of your chest after heavy meals, please go to a cardiologist, because studies have shown that patients who have a heart attack, I'm talking about the period before the attack. So it shows that even during the period when they feel completely normal, there is a feeling of discomfort in the chest. So you may actually feel discomfort in this area before your chest hurts. I am not saying that if there is discomfort in the chest, you should go to cardiology immediately. If it occurs with exertion, if you have many family risk factors, if you smoke, if your cholesterol is high, and if you frequently have a feeling of discomfort in this area lasting longer than 5 minutes, but less than half an hour, even if it is not a complete pressure sensation, I recommend that you get examined. Because discomfort in the chest can be a sign of heart disease. The second is problems related to the abdomen. The only pain of a heart attack is not chest pain. Sometimes there can be pains and complaints in the form of burning in the stomach, abdominal pain, nausea, or vomiting. These can also be a sign of a heart attack. In fact, in some heart failure patients, we can see abdominal swelling as the only complaint. The patient comes to us saying that their abdomen is swelling, and we see that there is heart failure. This is not something we see often, but abdominal issues, especially burning in the stomach, can be confused with heartburn. Please go to cardiology. It is probably gastric. Don't say that there is discomfort in my abdomen and it probably isn't from the heart. If there is a situation accompanied by newly started nausea and vomiting related to the abdomen, please do not neglect to go to cardiology. Even if your emergency treatment has been done here, make sure to have a cardiology examination afterwards and explain this to your doctor. Your EKG should be taken, an ultrasound should be done, some additional imaging may be necessary, and it may need to be investigated whether there is a heart-related disease. The third is arm pain. They always say that heart pain radiates to the left. Many people ask, "My finger is numb. Could it be from the heart?" Look, numbness in just this finger is not usually from the heart, even if it's on the left side. Numbness in just these two fingers is generally not from the heart. But heart pain does not always radiate to the left. If the pain on the right side of the chest is pressure-like and radiates to the arm or jaw, it should still be considered heart pain. Why am I saying this? Because sometimes heart pain can manifest in atypical forms, meaning it can radiate to the right side instead of the left, and it may need to be evaluated as heart pain. Please do not say, "If my right arm hurts, then it is not from the heart." Right-sided chest pain and right-sided arm pain should also be evaluated as heart pain and should lead you to see a doctor. The fourth is dizziness and a feeling of unsteadiness. This finding is especially important for women because men tend to feel the symptoms of a heart attack more intensely. We see burning or pressure in the chest in more typical forms, but especially in women, if there is no neurological problem, sudden onset, rapidly increasing dizziness, and a feeling of unsteadiness can be a sign of heart disease. Of course, in such a situation, you would go to the emergency room, and if there is a heart-related crisis, it will be diagnosed there, because an EKG will have been taken. If these complaints continue, if you feel unwell, and if you notice that these complaints are now endangering your daily life, please make an appointment with cardiology. Because after a heart attack, there can be blood pressure instability and pulse irregularity, which may not present as pain, but can manifest as dizziness and a feeling of unsteadiness. This is not a typical finding. It can also occur in men, and sudden onset dizziness can sometimes indicate a sudden slowing of the heart rate, which can also be a sign of a heart attack. A sudden feeling of unsteadiness or dizziness in an otherwise healthy individual, if there is no neurological problem, can be a sign of heart disease and should lead you to cardiology. The fifth is jaw pain. It is very typical of heart diseases. Chest pain is not always expected. If a patient tells me, "Doctor, it feels like I've eaten an apple and it's stuck in my esophagus. It feels like a quince is stuck in my throat. Doctor, sometimes it feels like I'm clenching my jaw." If they describe complaints like hitting their lower jaw, heart issues should be considered first until proven otherwise. Jaw pain can be a sign of heart disease, especially if you feel pain in the lower part of the jaw towards the esophagus, meaning if there is pain on the jaw side of the upper chest, this should lead you to cardiology. Why do I say this? Sometimes it even gives the feeling of clenching the jaw or grinding my teeth. This is because the nerve distribution of the heart can sometimes extend up to the upper jaw. What I'm trying to say is that issues related to the jaw may not always be related to the teeth. They can also be related to the heart. The sixth is early fatigue. Early fatigue should be considered a sign of heart disease until proven otherwise. Why am I saying this? Because in heart failure, after a past crisis, or in some other heart diseases, such as valve disease, early fatigue can be the only symptom. And early fatigue, let me say this as a note, is not a rare situation we encounter. When heart patients come to us and say, "Doctor, I used to climb 3 flights of stairs. Now I can only climb 1 flight and I get breathless after climbing more than 1 flight." If they say, "I am getting tired, I am feeling blocked," this is evaluated as a heart disease and advanced tests may be necessary. Early fatigue. If a patient says, "Doctor, my stamina has decreased. I also smoke. It must be due to smoking." This should not be assumed. Heart diseases should be ruled out first. The diagnosis is straightforward. An EKG is performed, an echocardiogram is done, exercise test may be conducted, or it can be understood whether there is a condition in the heart through some additional tests. What I'm trying to say here is that I am not saying if you are experiencing early fatigue, you have heart disease. But early fatigue can be the only sign of heart disease. Please take this seriously and go to a cardiologist. Early fatigue may actually be coming from the heart, not from the pain in your muscles. So when you say, "Doctor, my legs feel weak when walking," don't say that. Or when you say, "Doctor, I feel breathless," don't say that. Come to cardiology. Let's diagnose whether there is a heart attack or heart failure. Let's be sure. Then we may need to refer to other departments. First the heart, then the others. 7. Shortness of breath. Your exercise capacity may be good and you may still be able to climb stairs. If you feel short of breath or breathless while climbing 2 flights of stairs, you should think about the heart until proven otherwise. Why are these crucial? If the cause of an event is the heart, then this event is significant. If the cause of an event is the heart, address it quickly. It must be diagnosed. If the shortness of breath that has started is reducing your exercise capacity and shortening your walking distance, it should first be checked if there is something related to the heart. The reason for considering the heart first is this. Is it a sign of an impending crisis? Whether it's early or late stage, it is necessary to come quickly and get examined because we cannot stand. If you have recently started experiencing shortness of breath, please go to cardiology. Another symptom related to the heart, or perhaps the only symptom, swelling in the legs. A patient with swelling in the legs usually goes to 3 departments. 1, they go to cardiology because one of the causes is heart failure. The second, to go to a vascular specialist because venous insufficiencies can cause swelling in the legs. The third is to go to nephrology because protein leaks can cause fluid accumulation in the body, which can also swell the legs. Look, I'm telling you, first cardiology. Is there heart failure or not? If your leg is swollen, and you think this swelling wasn't there before, and if you have noticed that your legs have started to swell recently and it is increasing, you should come to cardiology first, because the only sign of heart failure can be swelling in the legs, while insufficiencies on the left side of the heart manifest as shortness of breath. Insufficiencies on the right side of the heart can cause swelling in the legs, and this can be the only symptom. Sometimes there can also be swelling in the abdomen. Look, I'm telling you, since the legs are the organs that are lowest in the body, swelling will accumulate in the legs first due to the force of gravity. And it is a common finding of heart failure. If your legs are swollen, definitely go to cardiology. Another symptom is cold sweating. If a patient is elderly, has no chest pain, smokes, and has one of the risk factors, if they say, "Doctor, I sweat cold while walking, but my chest never hurts. I never feel blocked, but I do have cold sweating. Then they should first go to cardiology, because cold sweating can be a sign of heart disease due to decreased cardiac effort capacity and the development of heart failure. If your sweating increases with effort, look, I'm talking about cold sweating. That is, the environment is warm. You exerted effort and you sweated. This is an acceptable situation, but the weather is not warm and you are sweating cold. You can see that your complexion is pale. You see that your pulse is elevated. Symptoms that occur with effort are related to the heart until proven otherwise. If no cause related to the heart is found for cold sweating, then you can go to other departments. Then the causes can be investigated. But first, cardiology. The last item, the 10th, is cough. One of the causes of a persistent cough lasting more than 6 weeks, that is chronic cough, could be the heart. Coughs can generally occur most commonly due to benign diseases, infections of the upper respiratory tract, or some allergic reactions. But if there is a persistent cough lasting more than 6 weeks, I recommend that you first go to a pulmonologist and then come to cardiology, because a cough alone can be a sign of heart failure. In the course of heart failure, fluid can accumulate in the axillary areas and alveoli, and this can cause coughing in the body because the accumulated fluid will try to be removed from there in some way. And this can only happen through coughing. Sometimes it is shortness of breath, sometimes it is a cough. If you have prolonged complaints, you must definitely go to cardiology. Don't say, what does a cough have to do with the heart? Believe me, heart failure patients can present with lung edema and only a cough, not detected. Sometimes heart medications can also cause a cough. For example, the antihypertensive medications we prescribe can sometimes cause a cough, and this situation can improve when we stop the medications. But if there is no medication involved, and the cough is a chronic one lasting more than 6 weeks, it should definitely be investigated for heart failure. You must definitely see a cardiologist. In this video, I tried to list the items. Frequently asked, do I have heart disease too? If you have any of these 10 items and there are risk factors in your family, please go to cardiology, because each of these can be a sign of heart disease on its own. Please don't forget to subscribe to our channel, turn on notifications, and stay tuned. Goodbye.